It is 14 minutes before the hour, and we welcome the awesome twosome from Marble City Pharmacy, Jared and Jacob. And good morning, gentlemen.
Good morning.
Yeah. You got the orange and blue today, I see.
Not planned.
Okay.
Not planned.
All right.
Happy accident.
Everything well?
Everything's going well. Yeah,
Spring is sprung now.
It's Monday. We're ready to have at it.
All
Yeah,
right.
we're ready to go.
Know your numbers. 1, 2, 3, 4. Is that the numbers we're talking
Congratulations.
about?
Very good.
Hey, know your numbers. Let's talk about this morning. What's this about?
Well, we want to talk about numbers in a segment today for the big three, basically. We'll call them the big three: the hypertension, diabetes, and high cholesterol. Literally the three most common conditions that we see at the pharmacy, the three most common conditions in the state of Alabama that are causing a lot of morbidity and mortality. And I thought that going with the Know Your Numbers segment, what's my blood pressure supposed to be? What's my sugar supposed to be? And how about my cholesterol? Thought it'd be valuable.
Blood pressure, different numbers for different people?
Yes, all of these, by the way, you'll find some different numbers for different people. You know, blood pressure numbers, actually, let me back up a little bit. Other reason we picked these three, other than just because they're the most common things we deal with, these are all things that, you know, first two we're going to talk about, people can, well, the blood pressure and cholesterol and blood sugar being the three. Blood sugar and blood pressure, you can check, you know, yourself all day, every day. And so people really need to know those. Cholesterol you're going to get every 6 months to a year when you go to your doctor, and they're always going to do that. And you can even get those checked more frequently at different places. But so those are numbers that you come across a lot. So we want people to know, hey, my neighbor said this, my neighbor said his number was this or hers was this. You know, we don't want a lot of misinformation out there. So that's where we're starting. But your question was blood pressure numbers. Different? Yes, but not what we used to think. Most of your listeners and viewers out there have been told before years ago that if your top number is 100 plus your age, you're all right. That's terrible information. And I mean, that used to come straight from our doctors and stuff. That's what we thought 30, 40, 50, 60 years ago.
Yeah.
That's not true. If you still hold to that, please let that go. No, for the most part, we want everybody, regardless of age, 120 over 80 or working slightly down from there. And so that's our goal blood pressure number. Age doesn't matter. You know, other things don't matter. Our goal number, 120 over 80. Well, I'm 80 years old. I'm okay at 160. No. We 120 over 80 is what we're shooting for. And as you go up from there, you're considered to be hypertensive or having high blood pressure as a disease.
Jared, I've been told by medical professionals that the older you get, the numbers kind of flip-flop. The number that you would normally use is not the normal they go by now as you get older. Is that correct?
Well, that's a good question. One of the things that happens as you get older is your systolic number, or the number that's on top, does become more difficult to control. You see a lot of our elderly patients who maybe their diastolic number, or their bottom number, may be in a good place, maybe in the 80 to 85 range, but their top number's in the 150s, 160s. You know, there are certain medications, not really what we're talking about today, but there are certain medications that do better at treating the top number than the bottom, you know, and vice versa. And so we want those people on those medications. But yes, for different populations, different ages, different medical conditions, different disease states, it becomes more difficult to control one or the other. But yeah, we want everybody to be less than 140 over 90. We really want to get down to less than 130 over 80 in everybody that we can.
Jacob, what drives our blood pressure?
All right, I'm going to give you this really technical definition that we don't want. You know, we're not going to use this, but blood pressure is defined as heart rate multiplied by, get ready, buckle up, peripheral vascular resistance. Word of the day. I got my one word, my smart words out, I'm done. Right. And it's basically how much pressure's in our vessels. You know, are they constricted? Are they clotted? Do we have a lot of cholesterol lining our vessels, making them harder to open and close? So the pressure in our vasculature, our blood vessels, veins, capillaries, all that fun stuff. And so that's how we define blood pressure. So there's two factors we treat. We can treat our heart rate and lower it. We can treat our vasculature and veins and open those up a little bit and lower it. So what affects our blood pressure, what makes it worse, anything that makes our heart rate go up, nicotine, caffeine, complete lack of exercise, all those things. And then, what we do with our veins. Cholesterol affects those heavily, our lifestyle affects those heavily, and then medications, of course.
Jared, staying with this just a second,
Sure.
What are some telltale signs physically that one might deal with when it comes to blood pressure?
Sure. You do find some people that say when their blood pressure is high, they know it because they get a headache, or maybe they have a little bit of dizziness. But let's be perfectly clear about this. Hypertension, high blood pressure is called the silent killer, because a large majority of people that have it literally have no idea. And so that's why when we have people who are outside the healthcare system, who literally haven't had their blood pressure checked in years by a physician, we need to get those people back into the healthcare system, seeing their physician, so that that can be monitored.
Talk about another one of the big three, so to speak, blood sugar.
Blood sugar, again, another one that's easy to check on your own at any time. This is something we keep up with a lot, and so many people in our population have diabetes. And so this is numbers that people are using and looking at a lot, and we want good information out there when we're looking at numbers. So most of the people that are checking on a regular basis have probably already been diagnosed as having diabetes or pre-diabetes or a good potential. So they're already, a little concerned about it. And those people that we're looking at, that have diabetes, we're trying to keep our, what we call our preprandial or fasting, or I haven't eaten anything glucose. When I test that, I want that below 130. I don't want it below 80. I don't want to bottom out. But somewhere in the 80 to 130 range is when I'm not eating anything I need my sugar to be. Now, after I've eaten, we realize it's going to go up. Our blood sugar is going to rise in the 2 hours after we eat. So after we've eaten, postprandial, another big word for today, we want our blood glucose after we eat to be 180 or below. We don't want it to creep above 180. And if we're doing that, we've been diagnosed with diabetes, but I'm keeping my fasting below 130 and my after eating below 180, I'm doing pretty good.
Again, that's for diabetics.
Yeah, that's for people with diabetes. Now, if you don't have diabetes, or don't think you do, and you check your blood sugar and you're getting numbers like that, it's time to go to a doctor, because somebody with no problems at all is going to sit there at any time, check their blood sugar. It's probably going to be less than 100. And you're going to eat, and you can eat whatever, and you're going to take your blood sugar, and it's not going to go up more than 130, 140 max.
Again, for people who may be just joining us this morning, know your numbers. We're talking with the staff at Marble City Pharmacy, Jared and Jacob. The blood sugar itself, now you may have touched on this earlier. How does an individual check their blood sugar?
Oh, great. Yeah, there are a number of different brand names, but we have home blood glucose monitors. And so it's a very simple process. Actually, the price of these and the strips that go in them to test the blood sugar have gone down significantly in the last few years. And so we can get you in a meter for free. The companies will donate those things to us. And then the strips we can get you in for a very, very good price now. That sounds like a commercial. I didn't mean for it to be. But basically, it's a finger stick sample, and so it takes a very small drop of blood, and then the meters will read that drop of blood within just a few seconds, and you get a number that's measured in milligrams per deciliter. That may not mean anything to you, and that's okay. But again, if you're somebody like us who's not diabetic, that number ought to be less than 100. And when a person who has not eaten overnight fasting, a fasting plasma glucose level, when that gets to be greater than 125 on more than one occasion, then the physician starts talking about, you might have diabetes. And so they'll recheck that again and be sure about that, and then give the diagnosis.
We talked about blood pressure and blood sugar. Does Marble City Pharmacy in-store offer these services?
Yeah, absolutely. There's not a day goes by that we're not helping somebody. More often blood pressure than blood sugar, but we have done that for people numerous times as well. We have a lot of people come in, hey, I need to I hadn't checked my blood pressure in a while, or I went to the doctor last week, had my regular appointment, waited, got my blood pressure checked. It was a little higher than I wanted it to be, so you mind if I come in here today real quick and let's check it? Yeah, sure. Just rather than going back to the doctor's office and waiting to squeeze in a blood pressure check, just come to the pharmacy. We can certainly check it for you. We have a lot of that. It goes, almost daily we're checking somebody's, and we're also able to use that time to do what we're doing here. And well, let me tell you a little about your number. Let's talk about, why is it up a little bit right now? Have you just done something in the last 30 minutes? We can kind of talk it through at that point.
And that's a very important point. People trust their pharmacists, and they should be able to trust them to listen to them and to provide information as you guys know it.
Oh, sure. And we have the ability, I don't know if you asked this or not, we even have the ability to check cholesterol. That's one of those things where the cost benefit probably becomes not so good for you guys, because you can usually get that done on your insurance at your physician's office or the lab, and not pay a copay for that. But, when we get the opportunity to talk to you guys about those numbers, we want to give you all the information you can, as much as you want to digest, because the more you know, the better you can take care of yourself.
Bad and good cholesterol, all of us have heard that.
I got bad cholesterol, I got good cholesterol, one's too high, one's too low. Does my total even matter anymore? As we grow in knowledge as a medical community, we look at things differently, we treat things differently. So what we generally focus on now, first and foremost, is what you would call your bad cholesterol, your LDL. That's the first thing that a doctor, a pharmacist, anyone's going to look at and work with. More important than your total number, more important than your HDL, which is your good cholesterol. We're going to start with that LDL, that bad cholesterol. And we're trying to get that number low. Average person, we're shooting to get that number less than 130. Now, stop for a second. Your very first question on blood pressure was, is it different numbers for different people? Not as much with blood pressure, not as much with diabetes. When we get to cholesterol, the charts are in tiny print and they're this long. Well, this is a normal number, but if you have this disease, let's do this. This disease, and it's this huge flow chart. And so the numbers vary greatly. So I don't want anybody sitting at home going, well, he said my number's got to be less than 130. My doctor said it needs to be less than 55. Who's wrong? Well, there are people who our goal is less than 55, which is a really aggressive goal depending on other diseases. And so, just know out there, we throw numbers out in cholesterol. It does vary greatly depending on other things that might be wrong with you, other disease states and risk factors. Diabetes, heart disease, kidney disease, whether or not you smoke, whether or not you're overweight. These numbers change a lot.
Define, and you may have done this and I ain't smart enough to pick up on it, define bad cholesterol and good cholesterol.
Oh, yeah. Well, look, here's a simple, I like to call it redneck definition.
Oh, no.
Here's easy to understand.
I picked with that one.
All right. Hey, there you go. That's right. Well, let me back up just a second. One of the things they'll measure in the lab is your total cholesterol. Well, your total cholesterol, it's pretty simple, just what it sounds like. It includes both your good and your bad, right? And so that's why we don't treat people based on their total number. The higher your good cholesterol number is, right, the better off you are. But that's also going to make your total higher. But that's okay, right? What we don't want is your total going higher because your bad cholesterol is getting higher. And your bad cholesterol, as Jacob mentioned, is what treatment is based on. So your bad cholesterol is what causes problems in your arteries, right? It builds up plaques in the arteries, which just means, in other words, it causes your arteries to clog, right? And it builds upon itself, and it makes it to where it's harder for the blood flow to get through there. And then eventually, those plaques may break off. And when they break off, they form blood clots.
That's trouble.
That's trouble. If it happens in the brain, you're talking about a stroke. Very serious problems here, right? Your good cholesterol, for lack of a better way to say it, literally transports bad cholesterol, takes it out of your body to the liver so that it can be processed. Wow. So your good cholesterol carries the bad to the liver so you can get rid of it. You want as much good as you can possibly get, right? Just for you numbers people, here you go. You want your good cholesterol to be greater than 40. All right, in men, very hard to get there. I think mine's in the 30s. In our family, ours is very low. If your good cholesterol is greater than 60, though, you're in a great place, and that actually becomes a negative risk factor. In other words, it's high enough to work in your favor if your good cholesterol is greater than 60.
Cholesterol over 100.
Cholesterol over 100. The bad cholesterol, slightly over 100 in most people. I'll take that all day, every day.
Okay.
If you have, again, diabetes, already known heart disease, if your family history is bad, depending on what age you are, there's a lot of factors. Some people, I'd say, no, that over 100, even if it's 105, we got to work on that. That's bad. We got to do some work. So it's very different for different people. But that total number, again, we're going to ignore that. But once you get that LDL over 100, again, most people fine with that, up to 130 or so. Even 130 to 160, and some people, we're not necessarily going to start medicine. We're going to go, hey, it's a little higher than we want it to be. Let's exercise a little bit. Let's eat a little different. Put the fried chicken down. Worst thing I've ever said, I know. And so, the numbers vary greatly in this population.
Yeah. We've thrown a lot of numbers out this morning. And a lot of people are just eating breakfast and they're thinking, wow, I don't know how I can digest my breakfast in this too. Why do these numbers matter so much?
That's the question of the day, right? I'll try to boil it down simply as I can. High blood pressure, as we talked about on this show before, leads to heart attack. It leads to stroke if it goes untreated for a long period of time. We talked about this on this show either last month or the month before. It leads to congestive heart failure, right? Your heart works so hard over so many years that eventually it just gives out, right? So those are the long-term complications for high blood pressure that goes untreated. For diabetes that goes untreated, long-term complications, and you guys have heard these before. There's damage to your kidneys, there's damage to your heart, there's damage to your eyes, there's damage to the nerves in your body. That's why a lot of our diabetic patients have pain in their feet. Sometimes they can't even feel their feet, numbness and tingling and such. So a lot of long-term complications for diabetes. For high cholesterol, what are we worried about? Like we talked about earlier, we're looking at blood clots. We're looking at heart attacks and strokes. So, these are not just numbers that we play the little pharmacy game on and that your doctor plays the doctor game on. These are numbers that are predictors of your long-term health, and they're super serious.
Jacob, I think Jared mentioned earlier about the numbers in y'all's family. Are these big three, whether it's blood pressure, blood sugar, or cholesterol, are these hereditary, these issues?
Absolutely. Another reason we like talking about these three is these are all things that I can do something to change. Unfortunately, I can't change my height. I've got this seat elevated nearly as tall as Jared.
Can't change your looks either.
Yeah, I know, seriously. If we stand up, it's a little different.
Trust me, we've tried. Yeah.
But these numbers, I can do something to change. However, some of us have something working against us. That's genetics. My dad has all three of these to some extent. Multiple other people in our family do. Something we have to be aware of. It increases our risk for all of these. It increases my need to pay attention to all of these. So if you're looking up that family tree and you find these things, doesn't necessarily mean you have it. Certainly doesn't mean you're doomed and you should not do anything about it because there's nothing you can do. That's not at all where I'm going with that. But we need to pay better attention because you do have a higher chance of developing these things. So be more aware.
And finally this morning, Jared, what role does a pharmacy play, pharmacists like you guys, to making sure that as much as you can to help us pay attention to these three?
Well, sure. A lot of times we first get introduced to our patients in these three categories because they come in with a prescription, right? At the point of the prescription, then it's our job to educate on the importance of taking the medicine every day. Will you have to be on this medication the rest of your life? A lot of times the answer is yes. Not always, but a lot of times it is. And so what can I do now that I've reached the point of diagnosis, now that I've reached the point of treatment? What can I do in my general everyday lifestyle to be healthier, to help get these numbers down in addition to what the medication is doing? Before we ever get to the medication, though, things like this. We like to do outreach in the community. What can I do to be more healthy? What can I eat? What kind of exercise should I do in order to avoid these developing me later on in life? Absolutely.
I want to slip this in right before we go.
All right.
Is it ever too late to change?
Never.
Okay.
That's a good question.
Now, does it change the level of exercise I can do if I'm 85 years old? Sure. Does it change certain things? Absolutely. But it's never too late to do something. Diet, exercise, cutting out bad habits, things like that. I can always do something and cut down my risk going forward.
All right. Thank you both for being here this morning.
Thanks a lot.
Health Monday with Jared and Jacob from Marble City Pharmacy every second Monday of the month here on Daybreak. More on the show coming up.